Thank you very much, Kat. Good morning and welcome, everyone. I hope the information that I share with you this morning will be helpful in some way. COVID-19 continues to place a high demand on clinics and hospitals, as well as impacting testing access. This webinar will provide information about other options for healthcare, including StationMD, and a new resource for COVID PCR testing provided by the Centers for Disease Control, or CDC. I want to start off by sharing an infographic from the Missouri Hospital Association. Here at the top it says, during this time of unprecedented demand on hospitals, know where to get your care. If you want to refer to this infographic at another time, Kat is going to drop this link into the chat for your use. And Kat, it's link number 1. Anyway, the infographic has recommendations for mild or moderate symptoms like fever, cough, tiredness, sore throat, and has other options listed for getting care. So sometimes it's often after hours or what have you. So a person might need to go to the ER to get checked out because you don't want to wait till tomorrow or even at urgent care. But we do have options for if it's not a serious condition. For the emergency department, on this infographic, they have listed symptoms of shortness of breath, difficulty breathing, chest pain, loss of speech or mobility, confusion, high fever. Those would definitely need an emergency department visit. But one of the options on this infographic up here, where it has mild or moderate symptoms, one of the options for getting care, it notes virtual care. And I'm going to go to the next slide and we'll talk more about virtual care. We do have a virtual care option that I believe is underutilized. I wanted to talk about it with you all today to remind you that it is an option for anyone with a waiver service. Anyone who is a Medicaid waiver recipient is able to utilize StationMD for virtual care. It can help get people care that they need without them having to get out to the emergency room or urgent care when they are not necessarily in an emergency situation. We will get into common reasons that StationMD has been used since it has been a service later on in this presentation. So if you receive a waiver services or you are a caregiver or family member of someone who receives waiver services and the individual receiving services has a medically related concern, you can call StationMD anytime, 24 hours a day, 7 days a week. The StationMD physicians are trained to know how to take care of people with intellectual and developmental disabilities. They do go through special trainings to be able to do this service for us. This StationMD service is also called the Health Assessment and Coordination Service and is a consultative telemedicine service designed for individuals with IDD receiving home and community-based waiver services. They are able to provide disability-specific advice on when best to see additional or seek additional or in-person treatment. They help to coordinate care with local emergency departments, urgent care clinics, and primary care physicians. They can also enable real-time support, consultation, and coordination on health issues, and to assist individuals, families, and support providers to understand what the individual's health symptoms mean and what would be the most appropriate next steps. Okay, so how to access this service. This telemedicine service was implemented during the coronavirus or COVID-19 pandemic as an option for individuals so they don't have to go out into the ERs or urgent care centers and risk, contracting COVID. It was an option that was created. So, and as I said earlier, it is used to provide assessments and care coordination to divert individuals from unnecessarily accessing in-person urgent or emergency care. The reason why not going to urgent care or the emergency room if a person doesn't need to would be, for example, the crowded waiting rooms and the probability of being exposed to other infectious diseases. Sometimes there are long wait times in the emergency room or urgent care clinic, especially when COVID cases are surging. Also, it is more comfortable for the individual since they can be assessed by a physician in their own home and not have to go through the stress or even trauma of having to go and wait in a clinic or ER. Sometimes that's just not a very good option for people. For individuals currently accessing this service through StationMD, the Division of DD will provide notification to their support coordinators to discuss authorizing the waiver service in their individual support plan. The service will continue as the utilization review approval process is completed. So for individuals who are not currently accessing this service, some have already started, but some have not yet, which is fine. But if a person chooses to use StationMD, there are options to start using. Individuals and their caregivers can directly contact StationMD as the need for health assessment and coordination arises. StationMD will provide the service and then notify the Division of DD. The division will notify the service coordinator supervisor and the service coordinator to add the waiver authorization to the individual's individual support plan, or ISP. If an individual has a waiver service, and for example, they are feeling unusually tired, have developed a cough, maybe a sore throat, they or their family or caregiver can call StationMD for a consult with one of their doctors. Another option is that individuals, families, and guardians can go ahead and call their support coordinator and request the new service to be put in their ISP before having a health issue. They can do that. That is an option. Another option is that individuals and teams can discuss at their next annual ISP meeting or even initial ISP meetings for new waiver individuals. For those individuals currently in the waiver who choose to utilize the health assessment and coordination service, the service will be authorized prior to March 1st of 2022. An ISP amendment may need to be completed if their annual ISP meeting falls later in the year. And this is just an FYI for the service coordinator's role. The memorandum that came out states that service coordinators are to, initially when this came out, to focus on any person identified as already having used StationMD previously, and then on anyone else as initial plans, new amendments, or annual plans come due throughout the year. Then they can have that as a choice, the individuals. Once all necessary signatures are obtained, the amendment, provider choice, or UR recommendation forms are to be processed through the typical ISP amendment workflow. In the event the added cost of the new service increases the budget beyond the capacity of the person's current waiver, an exception request will be necessary. They would complete the Health Assessment Coordination, or HAC, HAC, ISP amendment document. This is what is pictured on this slide. To request this service. This amendment document may not be used to request any other service. For the provider choice form, the service is HAC or HAC, and the provider is StationMD. State UR leads and or UR committees are to review and recommend approval. Regional office directors, assistant directors will approve the amendment. And then Kat will drop that link to this document into the chat. It's link number 2. So if you guys want to reference that. Okay, and then this next link, I'm going to have Kat drop it in the chat. It's link number 3. It will bring you to the StationMD page, how to contact StationMD. Here it says to first call their toll-free number, and if they are on another call, you can leave a message with your name, facility name, direct contact number, and chief complaint of the individual if you are calling on behalf of the individual served. There is an alternate number to call if someone does not get back to you. There are options to practice, like practice call, so that individuals, families, and caregivers can feel comfortable when reaching out. There is an email and phone number that can be contacted to arrange training outside of the times listed on this document. Looks like Mondays, Wednesdays, and Saturdays, they have special time set aside so that people can practice and get comfortable, because we want you all to feel confident being able to use this. And technology can be kind of awkward or kind of scary at first when you first start using it. Calling this number is the first step in order to get set up with them and have what you need for when you need to call them. Page 2 of this document has links to be able to download StationMD on an iPhone or Android phone, or you can scan the QR code with your smart device. It says that once you have the StationMD app installed, oops, sorry about that, you will be required to enter in a one-time passcode to access the app, or you can use the QR code you may have been given. The passcode will be given to you during your first call to the StationMD physician. Smart devices are something that maybe not everybody may have. Missouri is a technology-first state, and I will find out more about that for you. If not having a smartphone may be a barrier to accessing this service. If that's a barrier, I'm thinking there's something we could figure out to be done that we could do for that with our Technology First initiative. I'll find out more about it though. Page 3 gives step-by-step instructions with pictures to refer to if you're using an iPhone, which I think the pictures are always handy, but it's just step-by-step for downloading it. And it shows where to do the passcode. And then if you're an Android user, here is a step-by-step with pictures. And this is all on that link that Kat put in the chat that talks about how to access it. So if you're interested, you'll want to keep that link handy, or go to our website and look at the PowerPoint. You know, it'll be on there. We're lucky that we're able to collect information to see if this service is actually helping people and meeting individuals' needs. Many diagnoses that individuals have been seen for using this service are general health issues, which is what I think this encounter for issues right here is. They aren't feeling well, can't get into the doctor. You know, it can definitely be utilized for that and has been. Other diagnoses that people have had: cough, acute upper respiratory illness, rash, and other nonspecific skin conditions, urinary tract infections, vomiting, unspecified injury of the head, which would be an initial assessment to see if they need to get further emergency care. Let's see, not if they were unconscious or profusely bleeding. You know, this would be if they, you know, hit their head, they want to make sure they're doing okay, want a doctor to, you know, put their eyes on them and do an assessment, see if they need to be referred elsewhere. Other conditions listed up here on this slide: cellulitis, diarrhea, constipation. And as I said, these are just some examples. These are the top number of examples that people have used StationMD. This slide shows the percent, I don't know if you can see the numbers on it very well, that shows the percent of StationMD consults that kept the individual from having to go to the emergency department at the hospital when they did not need to. It doesn't mean that StationMD will keep people from going if they do a consult and they see that they really should go. But the percentages here show that consistently since January of 2021, that a high percentage of people could get medical care and not have to leave home when they are not feeling well. I don't know if you can actually see those numbers, but each blue bar is a month starting from January 2021 until December 2021. And it shows in the upper 80% to 90% of cases that did not end up having to go because they were able to use this service. And then I just want to add this, it's still the best idea to know where to recognize or when to recognize a life-threatening or very serious situation and call 911 or get to the emergency department. I just wanted to reiterate that, but I also want to reiterate that this service is to help people who don't need that level of care, but do need to have a physician check them out to see what they can do to help them get well and, you know, take those steps to get over their illness or condition or whatever's going on with them, to get those next steps. Observe, decide, act. I'm going to jump off of this PowerPoint to show you a brief informational sheet that we made that might be helpful and more straightforward for using StationMD. We're going to have this posted with the webinar, or at least on our site. I'm working on on these informational observe decide act pages to make them a little more easy to read in format that kind of pops out a little bit more. And this is one I made in a new format. This one's for using StationMD to hopefully make it easier for anyone who wants to use it. I know that sometimes using something new, especially technology, can be stressful. So we were hoping that this would kind of help with that. So I'm going to exit out of the PowerPoint and show the document. Observed, okay, how to access StationMD. Information leads to knowledge. Click off of that. Knowledge leads to the practice of prevention, and the practice of prevention promotes health. And so under observe, it talks about how it's part of the health assessment and coordination waiver service, and you can have this added to your ISP. Decide, so when can StationMD be used? Urgent medical issues such as fever, cough, tiredness, sore throat. It gives just kind of some of these examples that aren't really super serious. Sore throat, runny nose, loss of taste or smell, which we know what that could mean, COVID, headache, moderate pains, minor behavioral issues, seasonal infections, COVID, influenza, allergies, non-urgent issues such as medication refills. It's been used for that. When someone's low on meds, ends up running out and nobody reordered them, so that could be helpful with this. Constipation's a common issue, and if it doesn't get serious enough, they could utilize StationMD to kind of head it off at the pass so their bowels will be running better. Routine check-ins, referrals, like let's say COVID therapeutics. If someone has been diagnosed with COVID and maybe they could utilize monoclonal antibodies or some other therapeutics, the StationMD could help set that up. And then diagnostic referrals, as examples are COVID testing, flu testing. If they needed a chest x-ray, StationMD could facilitate that with a local emergency room or urgent care or hospital. And then also laboratory studies if they're needing that. Then we put on here, when is it better to call 911? As we said earlier, issues like trouble breathing, unconsciousness, severe distress, severe abdominal pain, chest pain, loss of speech or mobility, confusion or high fever, or anything that would suggest that a person's in immediate danger or in a life-threatening situation. And then how do you sign up for StationMD, which I think is the most complicated part, because it's technology, it's new. But right here this is on the sheet is the link to tell how to contact StationMD and download onto the smart device. And then below that, it's about make sure to call your service coordinator and then request that information be included in your ISP if you choose it. If it's about choice, if you choose to go this route, this is who offers it right now for us. And here's that link to the form that the service coordinator would fill out. So tried to make it kind of easier on there. And then down here is the link to that infographic to the Missouri Hospital Association that we saw at the very beginning, because that's where I got that first sentence. Because during this time of unprecedented demand on hospitals, nowhere to get your care, yeah, this would definitely help in situations where there's overcrowding in hospitals and emergency rooms. We've all heard the stories about people having to wait for hours upon hours trying to get help and get seen just because of the overflow of sick people. So I'm going to minimize this and I'm going to turn this back on. Okay. So COVID-19 testing resources. I'm going to go to the next slide, and I think I'm just going to go ahead and jump on this page as well. I have it pulled up. This is the Missouri Department of Health and Senior Services testing resources page. They have things that are kind of changed a little bit, but these are the options that are still available. I have another one to talk about too, but I'm going to just go ahead and bring you to the site. Come here, your thing. There we go. So here we have free testing sites that are sponsored by Missouri Department of Health and Senior Services. And you can see in St. Louis area, Kansas City area. I know the weather affected some of these due to the snowstorm we had, but these are current right here. Central area, Southeast area. So if that's an option for free testing that you could take advantage of, please do. free PCR at-home test kits shipped to the home. I'll show you what that link looks like. Order your test kit here, and it's got information. It's got an overview video, which is always nice to look at, both in English and Spanish. Back to, I guess I don't have, let me see here. Okay, free rapid antigen at-home test kit shipped to the home. Anyone can order, and they'll send you 4 per residential address, and that's sponsored by the U.S. Department of Health and Health and Human Services, and then the United States Postal Service. Let's see if that'll pull up. And see, that's what that looks like, and they're really easy to order. And orders will usually ship in 7 to 12 days. So order your tests now so you have them when you need them. Then free testing provided by pharmacies. You'll click on either here or here, and it'll give you the pharmacies in your area. You put in your zip code, and then it'll tell you what pharmacies you could go to get free testing. And then at-home over-the-counter COVID-19 test kit. Get it for free or be reimbursed. I'll click on that. And then this is from Centers for Medicare and Medicaid Services and tells how you can do that. So please be sure to keep this website flagged so that if there are any changes also, you'll have that information right at your fingertips. But anything for free testing, it will be right here. Okay, we reviewed that. So I'm going to go to this newer one that we came across, and I was able to reach out to their lead. This is an option for some provider agencies or group homes. It's with the Midwest Coordination Center. The CDC, in conjunction with the Department of Health and Senior Services, is providing PCR testing to certain populations, and our populations fit with that. The Midwest Coordination Center state lead for Missouri sent me some information. So if you have an agency that needs COVID PCR testing for individuals served, as well as employees, then this could be an option. Provider agencies or group homes are able to use this program, however, would need to make sure that the minimum requirement of testing 5 participants per sampling site is met. So 5 individuals served per batch of tests, at least one time. Excuse me, at least at one time. They call it a batch, which is a group of tests that will be sent off in the mail to the lab to be tested, and 5 is the minimal amount that can be sent off. The agencies who use this service would be responsible for creating a logistical plan to obtain that number. The Midwest Coordination Center's team could assist with figuring out those logistics. Additionally, the provider agency would need to make sure that the program is being used for the individual served and not just employees. It would need to be both. This is a testing program that is mainly for the populations within congregate care and underserved population settings. So that's why they qualify. And she double checked with her supervisor to make sure, so it's good. Okay. The benefit of doing the PCR testing is that serial screening tests of individuals who have no symptoms help to quickly identify potentially contagious cases and prevent transmission or further outbreaks. Other information about this option is as follows. All supplies, shipping, and testing are free. The sites or agencies are registered and paired with a laboratory that would provide PCR testing. So if you're interested and want to move forward with it, the team would help get your site paired with a laboratory. Get you registered and then paired with a registered laboratory. And then test results will be available within 24 to 48 hours from the time they are mailed from the agency to the lab. So that's kind of the turnaround we're looking for. If they're negative, it comes back faster, but positives, they go through another kind of a test to ensure, and that's that extra little bit of time. You're all more than welcome to visit their website, and Kat will drop the link in the chat. It's link number 5. If you're interested, please click on the request more information. on their website, and the Midwest Coordination Center's lead will have her team reach out directly to you. Also, if your agency reps want to participate in one of the Midwest Coordination Center's webinars to determine if this is a testing option that will work for you or your agency, provider agency, they are more than welcome to register for one of those via the resource page as well as on this website. And that's what it looks like. There's there's the home tab. Oh, shoot. Hang on a second. There's the home tab, about, and resources. So you can click on either one of these to get more information. And then this one, here you can just click on that and register. And the lead seems very, very helpful and very willing to help anyone if they want to see about it and see if it would be an option for them for, any provider agency or group homes or what have you. So that is, thank you for allowing me this time to highlight some existing resources that may help you as this pandemic continues. At this time, we will open it for questions. But before I do, I want to just remind you that this webinar will be posted on our website, as Kat said, so that it can be used as a resource. So I'm going to stop sharing my screen and we'll look at questions.
Leslie, I think I missed one of the links, and it's link number 4. What was link number 4 in reference to, please?
Let me see. Hang on just a second. And
it's health.mo.gov.
Oh, that's for the DHSS free testing resources.
Thank you.
Yeah, no problem. Thank you. Thanks for catching that. Appreciate it. Okay, I'm going to look through the questions.
We only had one question.
Oh, cool.
It is this, and this is in reference to StationMD, is this designed to replace a primary care provider, or is it an additional support?
It's an additional support, definitely. They'll communicate with a primary care provider and give information or what have you that needs to be given to them. It's just an additional support. Not always are primary care providers open or they can't necessarily always get in when they need to. So this is just an adjunct to that. Yeah, great question.
Okay, another question came in. Any idea when the Binex Now test kits will be able to be ordered again through the state?
Oh, that's such a good question, and nobody knows yet. Hopefully soon. As soon as we know, we are going to totally give everybody that information. And just right now, it changed, and it doesn't look like we just don't know yet. And I apologize for that, because I know it's hard. It's hard to not have those available like you need them. Hang in there though, and we're going to keep looking for resources, and hopefully that'll open back up again. Great question.
When you say communicate with, does that mean records will go to the primary care physician?
Yeah, they're supposed to. That's my understanding of it. And if anybody experiences any glitches or anything, please let us know and we will work through those. As more and more people come aboard, they might find that, but that is exactly the StationMD is supposed to communicate with. They're supposed to have the primary care provider's information and give that information whenever they have that consult to them electronically. I'm thinking, yeah. But if you guys ever notice a glitch, don't hesitate to let us know, because we want to work through that and we want to make it as easy as possible, because this is it's really to help individuals and not make things more complicated. So yeah, any issues, please let us know. And StationMD are really good to work with if we do have any, comments or what have you. Just FYI.
And consumers/agencies access StationMD before the authorization is requested or processed?
Yes, that is my understanding. I checked with the the lead who works directly with StationMD, and they should be able to call, but they need to let their service coordinator know. They're supposed to be notified through the division will be notified through StationMD, and that'll trickle down to the service coordinator. But if the individual or the agency supporting the individual could just let that service coordinator know, that would be really good.
Next question is basically is there a need for a guardian permission for the WebEx? How does that work? Or is that in the form with the SC?
It's in the form with the SE. I did ask that question. The way the way I understand it, they're able to call and go ahead and get that consult, and then that'll be taken care of after the fact. Now I know that sometimes when people are sick, or oftentimes their guardians will be already know about it anyway, and we'll be able to give some input there. I hope that answered your question.
And who do we contact if we have any concerns about StationMD and medical records?
That's a good question. We have, let me see here. We have a DD mailbox. I don't know. Do you have that handy, Kat? I don't have that handy. I want to drop something in the mailbox. Let me look here, see if I have that email handy or a different one. Because yeah, I don't want to just leave you hanging here. Give me just a second. I'm sorry, this is taking forever. Sorry about that. I'm searching through this for it. I do want to put an email in there for you guys to be able to reach out to us. Okay.
Sorry, Leslie, I don't have it handy either.
Oh, and you're fine. You're fine. I should have been prepared. Okay, we'll do this one. We'll do this one because I think that it would be appropriate. It's regional nursing, but got a concern about StationMD. Go ahead and put it there. Because I do want to help with that if there's any concerns.
How do we communicate an authorization or consent to treat with StationMD?
Now that is a good question. If the person is interested, I would go ahead and get to work on it now. Actually, go ahead and call that number. Talk to StationMD, and the service coordinators also should have had some sort of training on this as well. So that's where I would reach out to the service coordinator if the person's interested already, and also StationMD to get that, get those things in order.
The standing order from the Missouri Department of Health and Senior Services to do Binax Now testing expires 6/30/22. Have you heard if this will be extended?
I'm not sure. I am not sure. But that is a good question. I'll take that back to the table. I'm going to copy and paste that.
Do we have any more questions that you would like to ask Leslie? Please put them in the chat box now. I'm not seeing any more, Leslie.
Right. I thank you guys for your attention. I hope something, that we talked about today can be of benefit to you. If there's anything else that occurs or that we find out more information on testing or anything, we'll be sure to have another one of these scheduled so to keep everybody informed, or try to help promote, keep promoting, resources and everything. So you guys all have a great day, and I thank you again for joining.